As a pediatrician for over 20 years, I have treated many, many children for constipation. It is actually the number one reason why children come to their primary care provider is constipation. And it's a really difficult thing to handle. Most of the time, it's something called slow transit constipation, where the time it takes for the waste to go through the colon is longer than it really should be. And it's common, it goes away on its own, it can be genetic. And those kiddos in general need to have increased fiber, increased water, a really careful diet, really monitoring them for what exactly increases that time through the colon, because the colon is a sponge. Its whole job is to pull water so that you have solid waste coming out. So the longer that it stays in the colon, the harder it gets. And then we get something called fecal impaction, where there's a hard piece of stool up high in the rectum. The rectum is a large, loosey-goosey muscle, and stool will actually go around it. It causes pain. Then the kid's having diarrhea, and the parent's like, they're not constipated, and they actually are. So I actually wanted to tell you about something really exciting that I think can be super helpful for parents and pediatricians when their patients and children are struggling with constipation. It is an app called Pooficient, and this is a picture of the app itself, and I'll link everything in the comments as well. This app does everything that I do as a pediatrician and a pediatric gastroenterologist might do for typical slow transit constipation. It gives you a AI picture where you can take a picture of your child's stool. It'll tell you what Bristol score it is, which is what it's supposed to look like. It gives you feedback. I think your child needs more fiber. I think they need more water. You can put your child's diet in. It can help you make changes. It looks for trends. It goes through every aspect and helps with the main problem I notice, which is follow through. Follow through with constipation takes time, effort, and weeks and months. It also gives you downloadable information to be able to send to your primary care provider to let them know what's going on. So you can upload it to the portal, you can bring it with you to your child's appointment. So if you're interested in this app, definitely take a look at it. I've started using it with my own patients. It's everything I normally print out for them, but it's so much more helpful when it sends them a reminder. It lets you put in what medications your child is on. It'll remind you to give it to them. You put in their response, and it can help you communicate with your doctor about whether or not they need to change medication. So if your child is struggling with constipation, or you know someone's child is, share this app with them. I think it can be really important, and I'm interested to see what you guys all think. I also have a code to make it less expensive. So if you use my code, it actually makes it a little bit more cost efficient. But in general, I will tell you this cost for families who struggle with constipation, you spend more than that on medications trying to get it to work. If you have any questions about it, or if you actually use it or have used it, let me know.